You went into this committee an issue that plays on many individuals' minds regarding the medicinal use of marijuana. Before I provide you what Senate Bill 74 seeks to provide, I think it might be important to highlight what this legislation does not do. Senate Bill 74 does not authorize physicians to prescribe marijuana as a therapeutic drug. Second, the state will play no role whatsoever in the sale, transport, or dispensing of marijuana. The Ohio Department of Health's role is to issue registry identification cards to qualifying patients. Third, Senate Bill 74 does not allow for nor does it promote the use of marijuana by any other persons other than those that qualify under the guidelines set forth in this bill. The goal of this legislation is not to sanction the use of marijuana by the general population. Rather, this legislation is designed to provide relief from the symptoms suffered by desperately ill patients, to protect physicians from fear of prosecution by the state of Ohio for recommending potentially helpful treatments, and to uphold the sanctity and privacy of the doctor-patient relationship. Madam Chairman, on a more personal level, as I have stated in the past, 7 years ago I watched my father pass away in some very extreme pains of the result of 3 different types of cancer. And in his last weeks, he was put on a legal medication. And I think, and challenge anyone in this room that had to watch their parents die, that they would not reach out to alleviate that pain in any way that they could. And so I beg this committee, and I beg the individuals that are making this decision to think that through. In my last campaign for mayor, my opposition ran ads saying that I was for legalizing marijuana. And it's an easy trick to play on the hearts and minds of the voters when we use legalizing marijuana without saying you're interested in legalizing the medical use of marijuana. And it's a dishonest and disingenuous attempt to move the subject away from real use and the use of marijuana to alleviate pain, hopefully extend a better life, at least in the last part of someone's life, so that we can eliminate that pain. Madam Chair, I'll be glad to answer any questions.
Thank you very much, Senator, for your responsive testimony on Senate Bill 74.
Okay. I'm sitting here in front of Senator Higgins' office. He's the sponsor of the Ohio Medical Marijuana Act. We had our first hearing today, and we're standing outside waiting to meet with other senators of the Criminal Justice Committee to try and see if we can get a second hearing for our bill.
Okay, well, we split Senator Roberts 2-8, and they'll see if he can use his position to influence the committee chairperson, which is Senator Jim Jordan, into giving us a second hearing, so patients will have a chance to speak. Right now, they let us know that really nothing's going to pass. Their example was they can't even get a traffic light bill to pass right now because it is the end of the session. This is kind of a lame duck session of Congress now. But it is extremely important that we do try to push for a second hearing now to build up some momentum for the new legislative session.
Cool, thanks.